Well, welcome once again to Calaveras Living. You know, there have been a lot of advances in the whole idea of healthcare, but no more so, I don't think. I hope I'm accurate on this, but in dentistry, think how things have advanced in the last 20, 30, 40 years. I remember going to the dentist when I was just a tiny person, and it wasn't the greatest experience, but the last few times I've gone, been rather pleasant. So Dr. Dave Arnold is with us today, and he's been practicing now. He's told me 40 years. I can't believe that, Doctor.
Yes, 40 years in April.
Boy, you must have started young.
Well, I age well.
You age well. You had parents who...
That's it.
Nothing like genetics.
That's right. That's the best, is genetics.
But anyway, you have seen a lot of advances in dentistry, I'm sure. The techniques, the materials, all facets of dentistry.
Absolutely. Absolutely. It's when I think of when I was in school in Southern California in the early 70s, and to see a patient, you'd wash your hands and wipe the instruments down with alcohol, and away you go. And here today, you know, you don't do anything without gloves. Everything is the drills and the every instrument that we touch or everything that we use is either disposable or sterilized and packaged, and it's a different world. It's a different world now. I mean, that's just one facet of how much things have changed. But from just if you look at healthcare in general and the advances in healthcare, and then just put that into dentistry from just what we know about gum disease and its relationship with heart disease and diabetes and early birth pregnancies, to implant dentistry and to cosmetic dentistry, and the dentists now involved with sleep apnea, and with TMJ we're dealing with migraines and headaches and things like that. So it's a completely different world than it was 40 years ago. Who's
doing all the research to provide all this knowledge to dentists? Is that done in universities, or is that done by dentists themselves?
Well, it's kind of in both. It's both. I'm on the faculty at UCLA, and I go down there a few times a year, and there's just a tremendous amount of research in the oral cavity as a diagnostic tool. You know, for the use of saliva in determining certain precancerous conditions, and gum disease and its relationship to heart disease, like I said. And that's all really university-based. And the materials market, a lot of that is actually the companies that make the stuff, you know, and they're doing that. And a lot of that comes from Japan and from Germany and the United States. And then some of the changes that have occurred in orthodontics and early treatment, I mean, looking at the small child rather than the teen, has come a lot from the dental community itself. And so it's a myriad of different places, but I think it's led, and the standard of care is certainly led by the universities.
Okay, now in your practice you do pretty much cover the whole gamut of whether cosmetics or repair or cavities or whatever you can think of in dentistry. So where's it helps you the most?
Well, you know, in a small community like ours, I really made it an effort when I moved from Walnut Creek up here to try and keep as much as possible in my practice, you know, from making not making the dentures, but providing denture care and that level, and then the cavities and root canals and extractions and gum disease and that care. And so I really tried to bring it all into my practice and keep it there rather than, you know, go to a specialist for every little thing.
Yeah. How do you keep up with all the advances yourself?
I go to a lot of courses. We're required to take 50 hours of continuing education every 2 years as part of our license. But I generally lose count at about 300 or 400 because I go to a lot of courses. And I'm actually involved in several academies as part of the board. Like, I'm a past president and on the board of directors of a group called the American Academy of Anathologic Orthopedics, which has a lot to do with TMJ and joint function. And so I spend a lot of time going to courses. And I love doing that because that's where all the the new stuff is, and that's the excitement.
Sure. Do you find that your patients accept these things when you suggest something new that they had not heard of, and you tell them the benefits of it, that they're accepting of that?
I think for the most part, I mean, there's implants as an example. The alternative to if you've lost a tooth, and then historically we've generally either you have something that you can take in and out, like a partial denture, or bridge work, which is fixed. It has to do with crowns and then a tooth in between, and you cement it in, and that affects the teeth on either side. Well, now we can sit and go, hey, listen, I can put a tooth in that spot without affecting the teeth on either side. And it's predictable, it works. And I think for the most part, people are accepting that, hey, things have changed and we've got new things, and they're willing to go in the direction that I'm providing that education for them. But I think that they accept it pretty well.
Well, that's good. Now, an implant, when you have to take a tooth out, an implant technique, and I don't know that much about it, obviously. Luckily, I've got all my own teeth, and my mom had all her own teeth at 91.
Oh my gosh!
So
yes.
I guess I inherited that.
We're talking genetics again.
Yeah, that's right.
That's right.
But like a peg is put on there, or what's the technique for that?
It's a cylinder that is about 14, 15 millimeters long and maybe 4.5, 5 millimeters in diameter. But it's just a cylinder that's placed down into the bone and then allowed to integrate, where the bone grows to that cylinder. It actually attaches to it.
How is it adhered to the bone?
The bone just grows right at it.
Oh,
It's a titanium material that's coated with a calcium-like coating that bone likes. And so bone attaches to it and actually grows to it. So the implant becomes one with the bone. And then on top of that is where there's it's called an abutment, which is a cylinder that comes out of the cylinder that's torqued down into it, and then a tooth is put on top of it.
And that is virtually permanent?
Oh yeah, it's very permanent.
Okay.
And it, unlike a tooth has a membrane, and so there's a little space between the bone and the root of the tooth. It's kind of like this little hydraulic system, but implants are solid. They're absolutely solid in the bone. Very strong, very predictable.
Oh,
and in the 40 years that I've watched implants come from these blade kind of things and multiple failures to things now that are very predictable, very successful. They work really good, yeah.
Now, getting back to what you said about overall health, what is the connection with the mouth, or things that are going on in the mouth with various diseases like cancer or digestive problems or whatever you have?
Yeah, the first connection made was generally between arteriosclerosis and gum disease. And they found that there's markers in the blood that are generated by the body responds to both those things in identical ways. So, the question becomes, well, are they connected to one another? And is there a causative factor? If you have gum disease, does it make you more likely to have heart disease and a plaque in the blood vessels? And there's still a lot of work being done. I just read an article about that saliva is now providing markers that can determine precancerous conditions, mostly oral cancer, because that's what they're looking at.
Yeah.
But and gums in general are very, very clear indicators of changes in the whole body health. You can see diabetes in the gums. You can see different changes in medications. Pregnancy shows up in gum tissues. I mean, they're just really discovering that this is a window into the whole body health.
Yeah.
And I think it's going to be a major diagnostic place as time goes on.
And actually, most of the things about your teeth and gums, most of the things that are indicators of anything else are actually in the gums, not actually in the teeth, right?
Correct. That's correct. Teeth are still teeth.
Yeah, I mean, it's just hard.
And it's just hard stuff. And the good news about teeth is that the incidence of cavities in children has gone down. When we can fix a tooth now, instead of putting a big silver filling in, we can just bond a small amount of material in and save a lot more tooth structure. And so from that standpoint, but mostly what I'm looking at are from a health standpoint of the gum tissues, because there's blood circulating right on the surface, and you can really see what's going on in the body.
So as far as taking care of your teeth, I mean, we all should, brush and floss and all that, but flossing, I hear, is much more important than brushing.
Well, they do the same thing, and it's just that, and that's just
One does it better than the other, though, doesn't it?
Well, exactly. I mean,
Yeah.
brushing is just so, you've got these big flat surfaces, and you can get down around the gums. I mean, it's all right there, where plaque accumulates between the teeth and underneath the gums between the teeth. And that's where flossing is important, because that's an area that generally bacteria will accumulate. That's the first place where gum disease starts.
How soon after a person eats will the process of deterioration start to happen, or the food becoming possibly contributing to cavities? Or
Yeah,
it depends on the food.
Yeah, I mean, you're talking about sugars mostly that are kind of the problem. Refined sugars feed bacteria, and they create nutrients for the bacterial growth. And it's more the bacterial growth that causes the problems. It's the bottom line for gum disease and for tooth decay. It has to do with the bacteria. So food provides the nutrition necessary for the bacteria to grow. But the bacteria has to be there because it's part of our digestive system.
Yeah.
And that's the first place where food starts to break down. So it's important to have the bacteria on one level, but on the other level, there's bacteria that also can be very destructive. And it's the food becomes what you're putting in your mouth becomes the nutrients for the bacteria, and that's why it has to be removed. And the bacteria then is taken out too.
Okay, but say if you don't floss, if you brush, say, a couple times a day, but for 2 or 3 days you don't floss, has the process already started?
Oh yes. It's very interesting. They talk about that you need to see your dentist every 6 months and this kind of thing, and that was actually from a toothpaste commercial back in the 50s.
Well, you say brush twice a day, see your dentist twice a year.
Exactly.
Yeah.
And a lot of that stuff was said by toothpaste commercials without any research at all. But it's very interesting. It takes approximately 24 hours for the bacterial colonies to accumulate. So you need to really brush and floss, and you're going to hate me for saying, and my colleagues will hate me for saying this, but you really need to effectively remove the plaque on your teeth once every 24 hours, because it takes 24 hours approximately for that stuff to grow. And so if you can do it really good one time, then you really need to do it once. But generally speaking, 2 or 3 times is more likely for you to get all the stuff that you need to get.
Do most people take care of their teeth properly?
It's much better now.
Yeah.
I think people are way more educated now than they used to be. The adults now, got better education on health care and dental care in school. I mean, where, before, when I first came out of school, and even when I was in school, we just didn't get that kind of education. But kids are much more educated now, and people, I think the population in general, understands more now how to take care of themselves.
Okay. Now, basically, what's taken the place of the old types of braces that kids used to wear?
Well, they're still around. I mean, and I do orthodontics, and so, but there's different type of appliances that we use now instead of, or prior to putting the braces on. And now, instead of braces, we have aligners. There's this company called Invisalign.
Aligners,
Aligners, yeah, A-L-I-G-N-E-R.
Oh, okay.
To align
alignment,
something.
like wheel alignment.
Correct.
Okay.
Correct, exactly. And this company called Invisalign started this process where instead of putting braces on and then going through a sequence of wires and tooth movement and correction, you go through a series of these clear aligners that fit over the teeth. And so each aligner moves the teeth a certain amount.
Oh, slowly each day?
Slowly, yeah. Every 2 weeks or 3 weeks, you change an aligner to a new one.
Oh, so there's pressure.
So you go through maybe 25, 30 aligners. So you go through a whole sequence of these things, and each one of them, and this is all computer generated, each one of them moves the teeth a certain amount. So each one has the ability to push the teeth a certain amount, and then there's an increment of movement. Then you go to the next one and it moves them a little bit more. And then you go to the next one, it moves them a little bit more. And so you go through a whole series of these things, and at the end, you've got the correction. So instead of putting the braces on, you're going through a series of aligners. And they're clear, you can't see them.
Okay, and people or
People like
children
that.
wear them over their teeth during the day?
Yes, 24 hours a day. And that's the downside of them, is that if you don't get the compliance, if somebody decides that, well, these things are kind of bugging me today, I'll put them in my pocket, it becomes a problem.
Or you have to take them off to flush.
You take them out to brush your teeth.
I said flush and floss.
Yeah, flush and floss. I like that. That's funny.
We got to put that in a comic book about dentistry.
You've got to draw a comic on that one, yeah. Excellent, excellent. But you take them out to brush and floss.
Very good. You said it a lot better than I did.
And then, but other than that, they're worn 24/7. And if worn correctly, if you get the compliance and they're worn all the time as directed, they will move the teeth and they can be very successful. The only limitation, and that's being actually, we're getting past that now, has to do with jaw position correction. So your deep overbites or your underbites. It's very difficult with aligners to get as much correction, because you can't wear rubber bands like you can with braces.
Yeah.
And there's a lot of that final correction that's kind of difficult.
So that whole process, depending upon how poorly formed the person's teeth are, can be relatively short time or a longer period of time.
That's correct.
And depending upon how much pressure has to be.
That's correct. And there are certain cases that are just that it's not appropriate for the aligners. It's just it's too difficult for the aligners to deal with.
Okay.
And then you get more into your traditional braces and such.
Now, getting back to the old, pain going to the dentist, the grinding process, I mean, the drills are much more high speed now and less painful, right?
Oh, yes. We're running at 700,000 RPM now. And so you don't have any torque, but you've got so much speed, you really don't need it. And with the diamonds and things that we use, things can be done so much more quickly. And we're even starting to use lasers, and that's another advancement that has come along that has a lot of potential for to be able to maybe one day get rid of that drill and get rid of that sound that everybody
We'll
much
never
enjoys.
ultimately get rid of shots, though, or something, the numbing.
Well, it's kind of interesting because the lasers, there's an interesting relationship to the nerves and the laser energy, where if you can shine the laser on the tooth, you can actually get a certain amount of partial anesthesia. So it's hard to say. Teeth are one of the most innervated things in your body. I mean, the nerves around teeth are so exquisitely sensitive, and it's so difficult to manage that sometimes. I mean, and we have a way now with our typical anesthetics, that we inject, and it works. And it's going to be a while before we find an alternative. It really is going to be a while.
Yeah, I used to, when I'd go to the dentist when I was younger, and I didn't have to go very often because luckily I had pretty good teeth, but I didn't like the shots because they'd make my gums sore and they would stay sore for a while. And I told the dentist, a couple of dentists I knew, I said, just don't give me any shots. And he said, you'll jerk your head and then you'll really be in trouble. And I said, I promise you I won't jerk my head. And I could take the grinding.
Yeah, well, you're exceptional because, the anesthetic is for the patient, obviously, for comfort.
Sure, it's not for
but
the
it's for the dentist also, because the patient will move. And
well, it can zip into your...
Exactly. I mean, I've had it happen, and where somebody jerked, and you're dealing with things that can really make do some damage.
Yeah,
and,
really cut things.
And so it's very important that we have the patient still. And unlike surgeons where their patients are unconscious, they've got all complete management of that. Our patients are very much alive and very much conscious.
Well, it's a lot better than the dentist being unconscious.
Yeah, exactly. But the materials we use now, I mean, we can get in and out with injections with very little, if any, discomfort at all.
Okay.
And we certainly do everything to make it as comfortable as possible.
I'm sure you do too, because you want those back as patients too.
Exactly.
And you want them to stay out in the community.
That's
Boy,
your
he's
referral
good
base.
to deal with.
Absolutely, that's your referral base, and I treat everybody in my practice as if they're a family member.
That's
So
good.
that's either my child or my parent or my grandparent, but whoever's in that chair, I just assume that's my family. And I think if I keep that in my head every day, as I've done this,
Sure, it's
then
good
I'm giving the
attitude.
best service I can
They
give.
still have to pay, though?
Yeah, unfortunately, I got to pay my staff. Yeah.
Okay. Now, you mentioned materials. What are some of the really attractive, tooth replacements that look so good? What are they made of and they're so durable?
Well, we can go all the way from veneers, which are the thickness of a fingernail, that you can place over the surface of teeth, and they're beautiful, beautiful, and the materials now are these dilithium silicates and zirconia porcelain hybrid materials, and I mean these things. We've done away with metals for the most part. I mean, there's very little metal anymore. I mean, I was taught to do everything in gold. I mean, that's how far back I go. But now we've moved from gold to metal porcelain combinations to now just strictly these beautiful new zirconia and porcelains and dilithium silicates, which honestly look like teeth. I mean, and these things are generated by computers now, and they're milled in little milling units. And I mean, it's such a change in the time that I've done this.
Well, it seems you have such a choice too in matching colors too.
Absolutely.
I mean, I've seen that happen. Boy, that you have choice of colors and they're hardly discernible. I mean, to the human eye, but the dentist.
Yeah, and it's hard to match, but we have those capabilities. I mean, we have the depths of colors and things that when there was metal involved, when you had to put metal underneath the porcelain to get it to fit correctly, you didn't get the depth and you didn't get those colors that now we can actually see into these materials and get the depth of color that teeth have. Teeth are beautiful things. I mean, enamel is a beautiful structure, and we're getting as close as ever, not only to matching it aesthetically, but putting the strength into it too.
Yeah, there's probably no excuse for anyone not to have a nice smile, huh?
Well, the materials are there. The
They are
materials
there.
are there to absolutely just completely change the appearance.
What does the old term bonding mean? What do you take
Well,
place?
and actually, it's still a term.
Oh,
I
is
mean,
it?
what you're trying to do is take two materials and stick them to each other, and the one material being a tooth, and the other material being, in most cases, a resin. Whether it's it's the filling material that you're putting in the tooth, or you're bonding a little crack or a corner that's broken off a front tooth. But you're taking the enamel and then you place a material on it, a very weak acid about the strength of vinegar that etches the surface, and then you put a clear resin on it, and then you put a filled resin that is then set. And it actually microscopically bonds into that enamel, and that's what the bonding is the material actually going into that enamel and getting strength and getting it to stay there. And it's all done by light now too. It's all set by light.
Oh. When you see pictures of actors and actresses with just perfectly even teeth, all the same level and everything, are most of those cosmetically done?
Oh yeah. Oh yeah. I went to school in Southern California, and I do have some friends down there, and people who have worked, who had offices in Beverly Hills, and have worked on some of these people, and it's just what we're talking about. I mean, it's these veneers. You can take the veneers and you can completely reconstruct a smile. I mean, and you're doing it with very little work on the teeth themselves. I mean, you can almost do this without any preparation on the tooth, just by laying these and bonding these onto the surface.
You can even everything up.
Absolutely. And the color control, all of that is just, these materials are absolutely beautiful.
What about these companies you see on television? I don't know what it's called, Clear Choice. It seems like you can go in one day and you come out like a different person.
Yeah,
Is that possible?
It's possible. It's possible. The problem is they're talking about implants, and we're back to implants again.
Okay.
And the implants have to integrate into the bone, and that takes time.
But you can do a bunch of it at a time?
You can do a lot of. I mean, you can do 4, 5, 6 at a time. I mean, if you're doing like a full arch. But the bone has to grow in there, and if you put teeth on right away and put force on them, you're loading something that needs time to integrate, and
so more realistically,
you're putting
it's over.
force on it. So more realistically, you get the implants in, let them set and heal for several months, and now you've got something that's predictable and strong. Then you can put your teeth on.
Okay.
Yeah, I think that's a little bit misleading, but there are cases now, and I'm working on one right now where we're going to try and do this case where we're going to put the implants in and put teeth in right away.
Wow.
And it's just, I mean, we're light years away from where I was when I came out of school. It's just incredible, it really is.
Well, it's good you went when you did and you learned all these things.
Exactly.
But are the new dentists coming out now? They're up on all these recent things. Huh?
Yes, I think so. You know, I've had the opportunity to have some associates, and you know, color me old school. I mean, I kind of consider myself a dinosaur, but
Oh yeah, you're getting old. Come on, grow up.
But it seems that they don't get as much basic stuff that I got in school.
Oh yeah.
You know, they're sort of out into the new things and the new realms, I think, a little bit faster, and yet there's just basic dentistry. I mean, just basic, you know, how do you prepare a tooth, and how do you get these edges to seal, and things like that, I hope they're getting it. I hope they are.
It seemed to me in my lifetime that my wife and I have always been able to find a good dentist. Dentists, somehow, somebody would get on me too, some other doctors in different specialties, but good dentists, they seem to have a different attitude. They are more concerned with their patients, and they do skilled work over time and time again, whereas some physicians or some regular doctors just have no, I don't know, they have a bad attitude.
Well, you know, dentistry is, I think, unique in some ways because it's a very skilled art form. I mean, it's very technically, you know, and we have patients that, and we're doing it right in their face, and we've got pain management, and people are afraid of the dentist, and so it's a very unique kind of relationship that exists between a dentist and a patient, because we're very invasive, and people are anxious and they're afraid, and so it takes that, I think, that skill to help people kind of come down and be able to handle it a little bit easier.
It seems like an extra step up in level of compassion or something.
Yeah, sometimes I think we have to, because we've got those anxious patients.
Well, it's good to see you. I'm sorry.
Oh yeah, no, I'm enjoying this.
Well, you have to come back
you.
and we'll talk further. But I want to mention too, Dr. Arnold is coincidentally, and this is no joke, he's in Arnold, where his former name was Dr. Dave Walnut Creek. No,
I used that. That was good. Yeah, that's very good.
Anyways,
I
great
had to change my name, right?
good to see you, and we'll see you next time on
Very
Calaveras
nice.
Living. Thanks.